The sacral plexus forms within the pelvic cavity and exits posteriorly through the greater sciatic foramen. Here, most of its branches supply the gluteal region. After innervating pelvic and gluteal muscle, the major branch, the sciatic nerve, travels from the pelvic cavity to the posterior thigh. Notably, both the components, tibial nerve and common peroneal nerve, appear distinct and separate right from their origin within the plexus. On the posterior aspect, the sciatic nerve travels from the gluteal region through the thigh to the popliteal region. The tibial nerve is larger and running anteromedially, whereas the common peroneal nerve is smaller, lying posterolaterally. After emerging from the greater sciatic foramen, the sciatic nerve lies below the ilium with the two prominent landmarks, posterior superior iliac spine and posterior inferior iliac spine, and above the ischium with the two prominent landmarks, ischial spine and ischial tuberosity. Initially, the nerve follows the horizontal course through the gluteal region. At the midpoint between the greater trochanter and ischial tuberosity, it runs vertically and enters the posterior thigh. The line connecting this midpoint to the apex of the popliteal fossa is called the sciatic line. Anteriorly, the sciatic nerve is related to the neck of the femur and lesser trochanter, which are targets for the anterior approaches, whereas posteriorly it becomes accessible via various posterior approaches. After exiting the pelvis through the greater sciatic foramen, the sciatic nerve is well protected beneath the gluteal muscles. It is immediately covered by the piriformis muscle, lying in the space bordered medially by the sacrum and laterally by the ilium and ischial plate. The piriformis muscle serve as a key anatomical and sonographic landmark for proximal sciatic nerve blocks. A simple rule to remember: the parasacral sciatic nerve always lie deep to the two muscles, the gluteus maximus and the piriformis. Beneath the piriformis, the nerve rests on a muscular bed formed by four key muscles: superior gemellus, tendon of obturator internus, inferior gemellus, and caudatus femoris. This bed is remembered by the mnemonic stiff, and this is where the sciatic nerve lies in its most proximal course after leaving the pelvis. Anatomical variations in relation of the sciatic nerve to the piriformis are well described. Sometimes one of its components, either tibial nerve or common peroneal nerve, may pass above it or even below it. However, the most common configuration as per Bitton and Anson classification is where both the components lie below the piriformis. After leaving the gluteal region, the sciatic nerve enters the infragluteal portion, which is its most superficial segment. Here, the nerve is no longer covered by any muscle. It lies directly beneath skin and subcutaneous tissue. All hamstring muscles which originate from the ischial tuberosity are found medial to the sciatic nerve in this region. As nerve continues into the posterior thigh, it is crossed by bicep femoris muscle from medial to the lateral side. In this region, the bed of the sciatic nerve is formed by adductor magnus muscle and adductor minimus muscle, which is actually the uppermost detached portion of adductor magnus muscle. Thus, the sciatic nerve lies sandwiched between the bicep femoris muscle posteriorly and the adductors anteriorly.